Meanwhile, the World Health Organization is deploying what it calls a surge team to South Africa's Gauteng province, the epicenter of the outbreak of the new Omicron coronavirus variant. It's saying that it's helping with surveillance and contact tracing. South Africa has recorded a sharp increase in COVID infections, which have doubled since this past Monday. Health officials say the newly discovered variant is fueling the surge in infections. CGT Angelisa Ndamela has more.
The new coronavirus variant Omicron has now become dominant here in South Africa and is driving a sharp increase in new infections. The National Institute for Communicable Diseases says there's been an exponential increase in infections over the past 2 weeks, from a weekly average of around 300 new cases per day to 1,000 last week, and most recently 3,500. The Institute says hospitals are now seeing a significant increase in young patients in the pediatric COVID-19 ICU.
Probability that clinicians are admitting patients as a precaution while there are beds available, and so more, young children are being admitted, whereas, later in the wave they wouldn't meet the criteria for admission.
While key questions remain about how transmissible the Omicron variant is, health experts are rushing to determine the level of protection afforded by vaccines.
Some preliminary data that we have, there's definitely evidence that it is more transmissible and that there is some immune escape. But I think it's not necessarily that is related to severity.
As the cases continue to rise, there are concerns that the government will likely consider reintroducing strict lockdown measures during this festive season.
We can still have a reasonably, successful festive season. We can still manage to manage this in a manner where government doesn't have to invoke serious restrictions over the next few days. If we all just do our basic duties of the safety measures, but also if more and more of us who are eligible, everybody from 12 years upward, approach the nearest vaccination sites to receive our jab.
Many South Africans are now rushing to get their jabs.
As a businessman, I decided to vaccinate so that most of my clients mustn't be affect each other. Understand what I'm saying? So far, I'm so happy because I vaccinate my business, my client, everyone. They are so happy. They know the guy is free, protected.
I am an elderly person who is diabetic and have high blood, and I was made to understand that if you have all those things, then COVID will damage more, will give you more damage. So I decided to go and vaccinate.
My mother-in-law lives with us and she's got a lung problem. She's aged, so we don't want to. I'm not saying that I've ever had the symptoms, but in case I get it, if we pass it on to her, it could be a problem,
The government has informed the public that it is still following its risk-adjusted approach in dealing with restrictions. President Cyril Ramaphosa is expected to address the nation in about a week's time. It will become only clearer then whether the country will be placed on stricter lockdown for the festive season. Yudisa Njomela for CGTN in Johannesburg, South Africa.
I agree.